everyone and welcome to my channel. Okay, so we have started the preparation for pediatric subject and we have already discussed the following topics, that is growth and development, immunization, psychiatric disorders, infectious diseases. Now we will be discussing the CVS, in which the topics included are TOF, TGA, VSD, PDA, ASD, CCF and infective endocarditis. These are the most important topics of CVS and we will be discussing all of these in the following video. So starting from our first topic, okay, this is CVS and this is the first topic, which is Tetralogy of Fallot. We are having a scenario that there is a 3-year-old girl brought to OPD with history of frequent attacks of apnea and cyanosis while playing or running. During this attack, she sits down on floor in squatting position. On examination, she is malnourished, has central cyanosis and clubbing of the nails. She does not show any signs of respiratory distress or congestive cardiac failure. Okay, so what is given in this scenario, that there is a patient who is having the frequent attacks of apnea and cyanosis while playing, and when attacks occur, she sits down on the floor in squatting position and she is malnourished and centrally cyanosed and clubbing of the nails is present. So which disorder is this? This is Tetralogy of Fallot. Now let's read another scenario, that is there is 2-year-old girl who is brought to OPD with history of frequent attacks of the cyanosis while playing and running. During attacks, she sits down on floor in squatting position. On examination, she is underweight, has central cyanosis, clubbing of the nails. She also has pansystolic murmur on auscultation. These are the diagnostic points of the Tetralogy of Fallot. Then another scenario of TOF is that there is a 2-year-old present with the history of frequent attacks of restlessness and cyanosis, occasionally followed by syncope. Since few months ago, on examination, her height and weight is below third centile, means she is malnourished. She has central cyanosis and digital clubbing. On auscultation, she has ejection systolic murmur at the left sternal edge. So this is the Tetralogy of Fallot. Okay, so we are having the following 3 scenarios. Now let's discuss our topic. So when the following signs are present, that is frequent attacks of the apnea and cyanosis while playing or running or doing some activities, and the frequent attacks, and the patient sits on the floor in squatting position, and the patient is having cyanosis and clubbing of the nails, then this is the diagnosis of this disorder is Tetralogy of Fallot. Okay, now the findings on ECG will be right axis deviation plus right ventricular hypertrophy, that is large current flow from the ventricle. Okay, what will be the findings on ECG of the Tetralogy of Fallot? There will be right ventricular hypertrophy and also right axis deviation plus right ventricular hypertrophy. Okay, now the treatment of the cyanotic spills. The finding on the echocardiography will be right ventricular hypertrophy, pulmonary stenosis, ventricular septal defect and overriding of the aorta. These are the findings on the ECG. In the Tetralogy of Fallot, when we do the echo, we will do the echo and the following will be the findings, that is the right ventricular hypertrophy, the pulmonary stenosis, the VSD defect and the overriding of the aorta. Now the treatment of the cyanotic spills. Acute onset of hyperapnea and restlessness, increased cyanosis, gasping, syncope, increase in fundibular substruction with the further right to left shunting. Okay, what is the treatment of the cyanotic spills? We are having cyanotic spills? We are having acute onset of the hyperapnea and restlessness, increased cyanosis and gasping and syncope, and increase in fundibular obstruction with further right to left shunting. So the treatment is oxygen inhalation. Then placing the child in knee chest position to increase the systemic vascular resistance and to diminish the right to left shunt. Then morphine sulfate is given, that is 0.1 mg per kg by parenteral route to decrease anxiety and to prevent sympathetic overdrive. Then to correct the acidosis, intravenous sodium bicarbonate may be given. Beta receptor blocking agent, for example propranolol, in a dose of 0.1 to 0.2 mg per kg is given slowly intravenously to decrease muscular spasm of the infundibulum. Cyanotic spells can be prevented by propranolol 1 mg per kg orally every 4 hours until total correction is done. The surgical treatment for Tetralogy of Fallot is palliative surgery and corrective surgery. Okay, in the palliative surgery, a temporary increase in pulmonary blood flow can be obtained by creation of a systemic artery to pulmonary artery shunt, and Blalock tossing shunt is used in this. Right subclavian to pulmonary artery anastomosis is done. And Waterston shunt is used, which is the ascending aorta and right pulmonary artery anastomosis is done. Potts shunt is applied shunt is created between descending aorta and left pulmonary artery, and corrective surgery is done. It consists of the closing the VSD in resetting the right ventricular outflow obstruction, and if necessary, enlarging area with page. The timing of total correction ranges from 3 months to 2 years depending upon the expertise available. So we have discussed the case of the first scenario of the tetralogy of Fallot, in which first we have discussed the diagnosis, that is TOF. Then what will be the findings on echocardiogram in the case of TOF. So the following are the findings, that is right ventricular hypertrophy, pulmonary stenosis, ventricular septal defect, overriding of the aorta. And what will be the management and treatment of cyanotic spills? So the cyanotic spills are acute onset of hyperapnea and restlessness, increased cyanosis, gasping and syncope, that is increased infundibular obstruction with further right to left shunting. So the treatment options are oxygen inhalation, then placing child in knee chest position to increase systemic vascular resistance, then morphine sulfate 0.1 mg per kg by parenteral route is given to decrease anxiety, and then to correct acidosis intravenous sodium bicarbonate is given, and beta receptor blocking agents are given, for example propranolol in a dose of 0.1 to 0.2 mg per kg. The surgical treatment for the cyanotic spills are palliative surgery and corrective surgery. This is palliative surgery, which contain the Blalock tossing shunt, Waterston shunt and Potts shunt, and this is the corrective surgery. Okay, these are the surgical treatments for her condition. Now moving towards the next scenario, and what are the questions asked? These are the diagnosis, the finding on X-ray and echocardiography, the management and treatment of cyanotic spills, and the surgical treatment. So other things we have already discussed. Here we will discuss the findings on X-ray. The findings on X-ray are slightly cardiomegaly, narrow base produced by anterior-posterior arrangement of great arteries, given appearance of narrow pedicle, and heart shape looks like an egg placed on its side, and pulmonary vascularity may be increased or normal. The medical treatment of the cyanotic spill is to maintain adequate hydration to avoid hemoconcentration and possible thrombotic episodes, temperature maintenance to limit oxygen consumptions, blood glucose levels should be monitored to prevent hypoglycemia, hemoglobin and hematocrit should be maintained within normal range. Iron supplements are given to improve exercise tolerance. Bacterial endocarditis prophylaxis is necessary. Oral hygiene must be maintained. Partial exchange transfusion or phlebotomy or polycythemia may be required. Antibiotics and drainage to abscess to prevent the growth retardation, correct defect early and increase caloric intake, and counseling is necessary for psychosocial problems. Okay, so we have discussed the findings on the X-ray and the medical treatment of the cyanotic spills and the surgical treatment. Okay, what parts are remaining? In this part, we will discuss the complications and investigation options which are done for the tetralogy of Fallot. We are having the diagnosis TOF. The investigations that are done are is blood counts, that is hemoglobin, hematocrit, and RBCs count are usually mildly to markedly elevated depending upon the degree of arterial oxygen saturation. Chest X-ray is done. Heart size is normal, apex is lifted, and concavity is noted in pulmonary segment, giving the heart appearance of a boot-shaped heart. Pulmonary vascular markings are diminished, and aortic arc is right-sided in 25% of cases. The treatment of the patient is already discussed above. So the specific investigations are that of blood count, chest X-ray, ECG, and echocardiography. The complications of the TOF are cerebrovascular accident, that is in children younger than 2 years of age. This complication almost invariably is secondary to hypoxemia and anemia rather than polycythemia, sledging, and inside thrombosis. Brain abscess may occur, presents with fever, headache, vomiting, and cranial nerve pulses with raised intracranial pressure or other localizing signs mainly seen in children more than 2 years of age. It is due to the right to the left shunting. Bacterial endocarditis may occur, which is due to the right to left shunt. Polycythemia may occur, which is due to persistent hypoxia. Relative anemia may occur, which is due to nutritional deficiency. Failure to thrive may occur, which is due to the increased oxygen consumption and decreased nutritional intake. And psychosocial problems occur due to chronic diseases and multiple hospitalizations. So here we have discussed the first topic of the CVS, that is the tetralogy of Fallot. First we have discussed the scenario. Then what are the diagnostic points? So these are the frequent attacks of apnea and cyanosis, and the patient sits in the squatting position when the attacks is there, and the patient is centrally cyanosed and clubbing of the nails is present. Okay, so we have discussed the diagnosis, then the findings on the ECG, then the treatment of the cyanotic spills, then the finding on the echocardiography. Then we discussed the treatment of the cyanotic spills, the medical treatment and the surgical treatment. Then we have discussed the palliative surgery and the corrective surgery. Then we have discussed the findings on the X-ray and the medical treatment of the cyanotic spills. Then the investigations that are done for TOF and complications that may occur due to TOF, which are cerebrovascular accident, brain abscess, bacterial endocarditis, polycythemia, relative anemia, failure to thrive, and psychosocial problems. In the next video, we will be discussing the TGA, that is transposition of the great arteries. Thank you.